Question 18. Femur, tibia, fibula and patella. Firstly, the femur bone. This is the proximal end, and it has a head, a neck, greater trochanter, lesser trochanter. The head has a small fovea for a ligament in the hip joint. The two trochanters are connected by intertrochanteric line anteriorly, posteriorly by intertrochanteric crest. Behind the greater trochanter you have a trochanteric fossa. The shaft has a linea aspera on the posterior surface, medial lip, lateral lip. Lateral lip continues upwards as gluteal tuberosity, and the medial lip continues upwards as the pectineal line. Distally, the medial and lateral lip continue into medial and lateral supracondylar lines, which border the triangular popliteal surface. The distal end has a medial and lateral condyle, medial and lateral epicondyle. Anteriorly, the medial and lateral condyle is connected by patellar surface. Dorsally, it is interrupted by intercondylar fossa. Now for the tibia. This is tibia. The proximal end is expanded into the medial and lateral condyle. And the condyles bear superior articular surfaces, and these two surfaces are divided by the intercondylar eminence. And the intercondylar eminence consists of medial and lateral intercondylar tubercles, anterior intercondylar area and posterior intercondylar area. And then lastly, on the proximal end of tibia you have tibial tuberosity and fibular articular surface. The shaft is triangular in section. It has a medial surface, lateral surface, anterior border, interosseous border, medial border, posterior surface. And the posterior surface is crossed by soleal line. And the lateral border is also called interosseous border. The distal end projects into medial malleolus, marked by malleolar groove for tendon of tibialis posterior muscle on the dorsal surface. The lateral surface is smooth triangular and has a fibular notch, and then a distal articular surface which continue into a malleolar articular surface. Next we have fibula. The head projects into an apex and has articular surface for joint with tibia. The shaft is very slender. It has an anterior border, lateral surface, medial surface, interosseous border, and a posterior surface, posterior border, lateral surface. The lateral malleolus it has a malleolar articular surface on the medial surface and a malleolar fossa and malleolar groove. Both on the dorsal surface of malleolus.